The following is being brought to you by Vertical Vet. Rethink your GPO. Well, hello again, Vertical Vet family. I am Dr. Ernie Ward, Executive Director of Education for Vertical Vet. And once again, I'm really pleased to be bringing you some updates and information that you need to thrive and survive this coronavirus pandemic. Today, we really want to focus on our staff. How are we going to pay them? How are we going to get paid? How are we going to deal with laying people off or shutting down our clinics? I mean, there are so many unknowns, and literally hour by hour, things are changing all around our nation. And so today, I wanted to bring you an expert in all things with human resources, the legal ins and outs of what you can and can't do, sort of how some of these really urgent bills that have been passed recently by the House, and of course one of them has been signed into law by the administration, and now we have a Senate bill that's really moving quickly through Congress. How is that going to impact us? What do you need to know? So if you are worried about making ends meet over the next who knows how long, weeks to months. Today we have Jim Cichanski from Flex HR. Now, our Vertical Vet members are already very familiar with Flex HR. They do a wide variety of services for our membership. But most importantly today, we've got their CEO and president who knows more about this stuff than I ever could hope to know. So, Jim, thank you so much for joining us.
Well, thank you. It's a pleasure for me to be here and to discuss this unbelievable subject we're on.
Jim, I bet your phone and email box is stuffed with questions about what the heck is going on. How am I going to survive this?
Yep. I start at 6 o'clock in the morning and I finally end up at 11 o'clock at night trying to answer everybody and getting, it's tough, but it's fun. Just guiding everyone to the right decisions. That's the tough part.
And Jim, you've been through these types of scenarios before. I mean, obviously nothing of this magnitude, but that's why I really was eager to get you in front of our membership because, you know, I don't think there's anybody that I could trust more answering these questions. And I know a lot of this is fluid and dynamic. The changes are happening fast and furiously. However, I think you've got a pretty good bead on what's happening. So maybe if you could just start off and explain a little bit about what's happened. There's been a House bill that's been enacted into law. Of course, you've got a Senate bill that's now before the House. But maybe just give us the nitty-gritty details that a veterinarian needs to know.
Correct. Just over a week ago, a bill was passed in Congress, and it's called the Family First Coronavirus Response Act, and we are now calling it just the Act. And there's so many different components to it, and I'm going to break it down to make it understandable for everyone. First of all, the Act doesn't actually start until April 1st. Now, there was publication saying April 2nd. That was just amended only a day ago. So now it's April 1st, and then these benefits will be available to the employees of the practices, and you're going to be able to get money back for participating in these programs. It started out with small companies that aren't involved in Family Leave Act because you're supposed to be 50 employees and above to have that program anyway. And some states have already implemented some type of paid sick leave, Family Leave Act programs. About 18 states have done that so far. So this was a bridge to help everybody on a time of need for people needing to be out for certain things. So let me try to break that down. First of all, general guidelines for everything. All the money that you spend on these programs are 100% reimbursable, and it's through a payroll process. If you have 50 or less employees, you could request exemption out of this act, but I still haven't figured out one good reason to do that. And then let's talk about two basic components of this act. There's a paid leave act for childcare. Now, that goes in effect April 1st. However, most schools were closed by March 15th. And what Department of Labor intended to have happen, they did not state this very eloquently in the law, and that is they wanted you to use up your personal leave programs, vacation leave, PTO, sick time, all of that before this program went in effect April 1st.
And Jim, correct me if I'm wrong, but I think the requirement is you had to supply 10 days of PTO sick leave for this. Is that correct?
Well, that's when April 1st starts.
Right. Okay.
So
that was
on
the
your
thinking.
Own.
Okay.
Right. So you're on your own now implementing the policies you already have in place. Like New York has sick leave policies. Other states have, Oregon has sick day policies. So they want you to run through those policies, use those funds that you already have set aside prior to this taking effect April 1st.
Gotcha. So really, they're going to say default to your local and state, unemployment and sick leave
plans, right?
Plans
prior to April 1st.
Okay.
So once April 1st comes along, you have probably some employees that need to stay home because they're caring for a child, and also either the school's closed down or the child care that they used to send the child to is no longer open. So now that parent has to stay home to watch their children. So that is the biggest piece of this act, and it allows the first 2 weeks are unpaid. So we believe, and now we haven't seen the total write-up of this policy because April 1st they promised us all the rulings and how this will be all administered. But we believe the first 2 weeks already, if they're on that leave, have expended. So then you have to wait 2 weeks of unpaid before you move to the paid portion of this act. And that employee will get $200 a day max for up to 10. So the maximum of $2,000. Let's see, other details. You're encouraged to use your other leave prior to April 1st. Now, I know that a lot of you have PTO, and you accrue by the pay period or by the month. My gosh, we only went through 2 months this year, so employees don't have a lot of hours accrued yet, right? So being creative, many organizations are saying, you know what, we will allow employees to use up their entire accrual of PTO for the year now, if they so elect to take it.
Gotcha.
So they have a paycheck coming. And that seems to be going off very well with employees. And, let's face it, the way we treat our employees now is going to last in their minds for 10 years. So treat them as good as you possibly can and could afford.
Yep. We had a discussion in one of our earlier webinars on that exact topic. And Jim, I really appreciate you stating that, because I think that the employers that do somehow, get through this and really support and nurture their staff, they're going to see loyalty like we've never seen before.
Absolutely. So take care of them. I have 35 employees. Literally, they're all working from home, and they're enjoying it. We do some Skype parties every once in a while just to see each other, and because they're getting a little lonely sitting in their little bedroom or wherever they're conducting the business today. So we're trying to do different things. So we're trying to have fun at working at home and helping all of our clients.
Yep, and we're going to be addressing that on some future webinars as well, like how you can stay connected to your staff even if you guys aren't in the clinic. But so again, we're kind of focused now on 6201, the House bill that is signed into law, goes into effect April 1st. Is there anything else that we need to know? We've covered sort of the unemployment, and if your child is, their
Yep.
schools are closed or childcare is unavailable. What else do we need to know?
So let's go into basically the second part of that act, and that is the paid sick leave portion. Now, there are certain specific requirements to get the sick pay. You're quarantined directly by order of a doctor or an isolation order, which usually some piece of the government will give you that isolation order because you were part of a group of people.
And Jim, I just want to jump in real quick because that's an important point. I've been getting questions that go like this. My staff member thinks she may have COVID-19, but she can't get tested or can't get to the doctor. Is she going to be part of these new laws? And Jim, tell me if I'm wrong here, but I told them unless she has like a doctor's note, a certificate stating that she's been diagnosed with COVID-19, she's not going to fall under these guidelines. Am I right?
You're right, and that's the second bullet point I was just moving to, self-quarantine, but being advised by a healthcare advisor. So there's the key. I feel like I have symptoms. I am calling a doctor. We're using telemedicine today. All of those doctors are quite reasonable. They understand that they will email you a note saying, I quarantine you. You have symptoms, you need to quarantine yourself, so at least you have some doctor proof. We don't know what the Department of Labor is going to ask for to support getting this funds back. So I would suggest highly you get a doctor's note, because now you are letting this case have a doctor handle, not you.
Right.
Also.
Yeah, I brought this up last week, and I said, really, in this time, you want to have a doctor's note for all of this to document it. We don't know what they're going to request or require in the future. And I got a lot of kind of comments later saying, wait, can we ask our employees to bring in a doctor's note? And I was like, absolutely, I would encourage you to do that at this point.
Right. And remember, the paid sick leave is for 10 days. So it's not a lot of time, but it's for the quarantine period. And that pay is $511 maximum a day, which is, it takes care of most people. However, if they do go on sick leave, I would recommend highly you do not allow that employee to return until what? You get a doctor's note saying they can come back to work. Protect you and everybody else in your organization.
Yeah, we had that come up last week.
The employee says, well, hey, Millie is back to work. Doctor's note, she's totally cleared and she can come back to work. You'll at least have some defense. Again, you have to use the PTO time, all of that stuff, until April 1st when this kicks in. So if somebody is on quarantine already, and now they hit April 1st, you then could start paying them according to this act, and you'll get relieved in payment for doing so. So remember that. So that really is of the current act that Congress passed and has been released by the Department of Labor. And of course, when Department of Labor releases an act like this, it takes them almost a month to write the rules. So we're waiting for those final rules to happen, and then we could guide even further how to do some of this stuff.
All right, so let's switch gears then to this new pending legislation. I think this is what's got a lot of veterinarians excited, because I think there's going to be tremendous release for small business owners all over the country. Obviously, this hasn't, at the time we're recording this today, which is March 26, 2020, hasn't been finalized in law, but we do have a pretty good insight into what's going to be in this legislation. So maybe walk us through this new Senate bill.
Yeah, we at least know the elephant print. We don't know the peanut print on it yet, and it's going to take a while to find the small print on this stuff. But we are excited about the small business loan. And one of the major things that I have been giving guidance on is, if you are thinking about laying off your people and you think you have a week or two of money in the pot to continue paying your employees, I think you should do that until the act comes into law. and we see how it works, we have a pretty good idea what is going to be involved in this act. It's going to be you going out and getting a business loan. And that business loan has to be with the proper institution. So I would go to your bank. I wouldn't go to the next email you get on, hey, do you want a loan? And make sure that this is a forgivable loan in accordance with the Small Business Association program for this. But what they're saying is, if you maintain at least 90% of your staff, meaning you only can lay off 10%, you will be able to get reimbursed by forgiveness of your loan, their payroll, their expenses, and even your expenses like your mortgage or rent on your building.
Right. And I just want to repeat this. So this is good legislation. This supports small business through a very, very tumultuous time. And basically what it's saying is, A, you've got to maintain 90% of your current payroll. So when this thing starts, you can't just lay off half your staff. That's going to cause problems for you, and you may not
Correct.
be eligible now for this small business loan. If you do maintain that, you're going to take a loan out, but it's not like a loan that you're going to have to pay back as long as you meet these criteria and requirements. And so that means that you're going to take out this loan for $10,000 that floats your payroll expenses and lease for this 2-month period. That's the initial period that has been paid for, or budgeted for, I should say. And at that point, you will then be reimbursed by the government, correct?
Correct. Now, obviously, we're waiting for this law to be passed. If it goes through Congress the way it's written, I understand that amount is for 2 months of operating costs. So that's a pretty good chunk of money coming to you that will be totally forgiven.
And Jim, is it going to be 100% of the payroll? So if a person would receive a check normally for $650 a week or whatever, is it going to be for that total amount?
We believe it's the total amount of the wages. We have to see the small print. We expect it to also include the benefit costs for that employee. And the big question that's not written and not discussed yet is, will the taxes also be part of that cost, which we see it on our side as an operating expense.
Right.
So we think that all of that will be part of the forgiveness. Yes.
Yeah, and I'm also hearing that from other people like you as well, Jim, that we think that's part of it, or that there will just be a forgiveness. There will be a suspension of these taxes during this period. And
Right.
I want to point out one thing too. Number one, I'm incredibly supportive of this legislation. I think this is the right move for small business owners in America, because small businesses, that's what we are. We are the engine that drives the heart of America. If you look at what's being floated, and I guess today they perhaps are going to enact it in the UK, for example, and in Canada, they're only going to allow like 80% of the payroll expenses, right? So there's going to be a gap there for sure. So the way we're all interpreting it, and I love having Jim here as an expert because your interpretation is the best. You're saying, look, this is going to be for whatever they would have normally received during this period, 100% reimbursement.
Correct. We do have a couple of clients in the UK and Canada. The UK did the 80%, and it looks like it could be for a longer period of time than the 2 months. But it's an automatic. Of course, they have national insurance, so that'll be taken care of by the companies too. So it might be a wash when you take a look at that.
And Jim, I did see reporting, and I actually watched the interview with the Senate Majority Leader, Mitch McConnell, who stated that the 2-month was a starting period and that there would be provisions to perhaps extend that should the need arise. Is that also your understanding?
It is. The statement that key senators and the Treasury Secretary stated as of even yesterday was, this is a true $2 trillion bill, but it could grow to $6 trillion. So there must be some clauses in there that reenacts additional time frame if this thing is still a crisis in 2 months.
Okay, that's great. So
Yeah.
again, that's the big home run hit of this bill. Obviously, there's a
Huge.
lot of other things built into it, some that we'll agree with, some that we will not agree with, I'm sure. But is there anything else in this pending legislation, Senate Bill 3548, I believe it is, that you think veterinarians need to know about today?
That's the big one. The small business is the big one. I don't think any of us are worrying about the big business and will the airlines make it or the hotels make it. There's a lot of funds for those guys. But way back in 2008, I believe they did the same thing with big business owners where they didn't take care of the small business owners. They're going to have to repay their bill. The small business owners will not. So I think it's a triple win for small businesses.
Okay, a
really,
couple of
really
quick
happy.
questions. What do you think the requirements are? Like, how difficult is it going to be to apply for these loans? Is this going to be like 200 pages of paperwork, or is this going to be a fairly simple application process?
Well, at the beginning, I actually had one of my clients file for a loan, and they said it was going to take 4 weeks plus another phase 2 period, which would take 48 hours to basically cut the check. And I told her that I think she needs to go relook at that loan and see, because what I'm hearing is you go to your bank or institution that you are very comfortable with, fill in literally a 2-page document, and you should be approved within 3 to 5 days and the money in your account. So
that's great news, because there are going to be some businesses that are going to be tight. That's my biggest fear.
Yes.
Jim, it breaks my heart, but there are veterinary practices and of course innumerable small businesses that are week to week, month to month. And so I was worried that there was going to be a period, like you said, of 3 or 4 weeks before they actually had money in hand, which means they can't make it. So you think it's going to be much more expeditious?
Well, I think the government's already printing the money, so they already have these pools of money set aside. I think they just give access to the authorized agencies to go draw upon the money and get it out to the people. The one that scares me probably is the $1,500 check that the IRS is going to produce off of the 2018 tax returns, et cetera, et cetera. And they claim that within 2 weeks they're going to have most of it deposited in everybody's account. I have never seen the IRS move that fast, so so I'm going to hold my breath on that one, but we'll see.
The only time the IRS moves fast is when they're depositing my check, and then of course it's immediate.
And what I like about the employment piece of the act is that's right. We really haven't talked about unemployment, have we? And probably this is a good time to talk about it. So first of all, the states have set up their own unemployment practices, okay? And you have to go through the state to get unemployment. They usually have a set amount that they're going to give an individual at how much of income they make, et cetera, et cetera. I'll just give you for instance. One state says it'll be a range between $45 a week to $330 a week. So you could, and of course, that's for a part-timer that hardly works, probably is the $45 one. For a highly paid individual, that's $330. So I say, let's take a look at an average person getting about $250. So they stated that they will get that, and then they will get a federal subsidy that'll come along with that check. So the state will draw the federal money and then pay the individual through their system and get an extra $600 a week. So that's $850 a week, approximately, for that individual to get unemployment. You add that up, at least it's about $3,000 a month. At least they could pay their mortgage and buy some groceries. So it's much better than any unemployment situation we have ever had in the country.
Right, and that's why we wanted to have you and Flex HR as, wanted to tell vets. So Jim, again, you and I have had this conversation before, but would there be a situation where a vet should not apply for this loan? Like paint that picture for me. You're under 500 employees, so let's just say you already met that minimum threshold. Can you come up with a scenario where me as an employer of 40 people shouldn't go out there and apply for this loan?
Well, I put 15 senior consultants in a room to try to figure that out. We have not come up with one reason yet. Unless you think that you're going to spend it without spending it the right way. But I mean, it's a gift. It's literally a
Right.
gift for small businesses to stay in their practices. I think the big thing is well, some of these companies probably didn't even close down or didn't have to close down, or only half of it had to close down now. But it's either going to go into one pot or another if you think
Right.
about it.
Right.
It's either going to go into the unemployment pot that the government's going to have to pay, or they're going to say, companies, you take it on, you keep them on payroll, you run all
Right.
that, we'll just give you the money for it.
Yep. So maintain 90% payroll during this period, and that's really
Right.
the big requirement. And it's interesting, Jim. I'm sure you and I are having a lot of the same conversations with veterinarians and business owners all over the country. And I was. This is how I framed it earlier today during a lunch call, and I was like, okay, look, here's how I see it. You and this person was saying, I don't need this, right? I'm doing fine. And that's great, right? But I still encouraged this person to apply for this because I said, what if there is a economic downturn on the other side of this and your business for the rest of the year is down 15 or 20%? This little 2-month, as you say, gift might just be the difference at the end of the year. Am I off my rocker with that?
That's exactly how I see it. It's a bridge to at least trying to make what you did make. Sure, the money might shift from here to there. However, I haven't talked to one practice, and I probably talked to 100 at least practices in the last week. I haven't talked to one that says my business is 100% of where it's at today, 2 weeks ago.
Right, right.
Some of them are down only 10, 15%. And of course, those are in the states that aren't quarantined
Right.
as bad. And then I'm hearing as low as about 30, 40% of their business is still left. So, yes, you need this to survive.
Yeah. And again, I if you're looking at what most of the financial houses are forecasting, I want to be clear, and this is whether it's UBS, Goldman Sachs, or whomever, but we're looking at a significant downturn in Q2, and then H2. We're gonna it's gonna take maybe 5 quarters to climb out of this.
We're not going to, we're not going to even walk into a grocery store the way we used to 3 weeks ago. We're not going to the movie house, not going to a restaurant like we used to. If we walk into a restaurant or a bar and it's too packed, we probably will walk out. It's the psychological stuff that's happening in our minds, and we're going to be fearful for a long time. So the economy is just not going to wake up overnight and everybody's spending 100% anymore. And you got to remember, a lot of people lost a lot of money in the last couple of weeks too. So we got to be cognizant of that and make sure that we get it right. Now, let's talk about practice that's sitting there at that 30, 35% level of revenue coming in and saying, I can't hold on. I cannot wait to then keep my people or 90% of my people on staff to pay them. I have to lay people off now. I don't have money in the bank to pay them anymore. So let's talk about the options of laying off people, what that means, and furloughing, and all these words that we're now hearing maybe for the first time we ever had to think about it. So if you must reduce your staff, most are first looking at, because we still see this as a short-term situation, maybe 2 months at the max. And if we look at it, the concept of furloughing an employee versus laying them off seems to be the best option. Now, what's the difference between furlough and laying off? In a furlough, you basically tell an individual, listen, I have to let you go. However, you're still going to be considered an employee. I'm going to pay for your benefits during this time frame. And I suggest highly you give a time frame and a letter to that employee saying, I'm furloughing you for 2 weeks or 3 weeks, depending on the city you're in, the state, and what's going on in your state. New York, it could be a month at least. So you tell them, however, we're going to pay your benefits. And this furlough you could go and collect unemployment because you're unemployed. So they're happy because here we go, the $850 or so a week, they're at least getting some income and their benefits are paid. So there's the next kind of furlough, and that is a partial furlough where you sit there and say, hey, all staff, I'm cutting your hours by 50%. We're going to come up with a schedule. You're going to work Mondays, you're going to work Tuesdays, you're going to work Wednesdays, and whatever.
Does this, excuse me, Jim, does this have to be distributed equitably, equally across the staff? Everybody takes a 10%, 15%, 50% hit.
You absolutely don't have to, because you might want to do it in need of skill set in your practice. Like, you might not tell the vets that they could be gone, but yet you could say to some technicians, I don't need all of you, or I don't need all the front office staff, or something like that. So you're probably more in segments. I would also suggest that you ask for volunteers, because there are some people that say, hey, I'd rather be home by myself, not with somebody that I might catch this big thing. And you might have enough people that just volunteer to go on furlough. So there's several ways of coming up with what I would call a non-discriminatory way of doing it.
So, Jim, just be clear that this now counts against that 90% to get these business loans that are going to be,
right,
completely forgiven. So if you're in that, this is sort of that desperate place,
yes,
right, for a lot of us.
This is if you can't wait to get the loan and you got to do something now. You don't have any dollars left in the bank, and or you got little and you want to stretch it out as much as you can.
And again, no judgment, no shame here, simply because what you really want to do is preserve the business at all costs. And the government now, federal government, has instituted this one level, but you have to maintain this payroll. You have to be able to maintain it for 2 months or so. But if you are actually in dire straits, it is, I'm 100% in agreement with this. And, let's hope most vet clinics don't have to go there, but this is an option. And when I quite frankly was not clear on if I would, some discriminatory, if I could say, well, you've been here for 6 months, you've been here for 6 years, but you're saying, honestly, the employer can pick who and how.
You could pick based on, need in the job. Now, what are the best methods of doing it? First of all, I'd ask for volunteers. Now, I had one organization with about 110 employees, and the owner went and asked them, and guess what? Like 95 people said, I'll volunteer.
Oh, wow.
We had too many volunteers. I mean, it was like shocking almost. But anyway, usually there won't be that many. But then you could also do the method of last in, first out.
Right.
So it's your less seniority people. However, it seems like these seniority people want to say, I want seniority. I want to be gone. And so take it on seniority, but then most owners say, oh, but that's my most experienced people.
Right.
And I need them.
And, and it's interesting. So we had a similar situation, Jim, back in the SARS epidemic when we did see some downturns. And it was amazing because our older, more experienced staff, and some of these were, kind of, we call them part-time, older employees, but they were the ones to volunteer because they wanted to preserve the job and income for the younger people with families, and a little more vulnerable. So you've probably been seeing that as well.
Yeah. And then the fourth way is performance, just strictly saying, hey, I got 3 people on written warning and they go first. So there's so many different methods to do it, and you just got to look at your organization and what's best for you and your operations as well.
Wow, this has been amazing. And we're not done with you yet, Jim. But one other quick question, and I wanted a clarification. In the original House bill, the Families First, Coronavirus Act, I believe there was a provision in there that guaranteed job security. Maybe it was a 12-week. Maybe you could speak to that.
Yeah, in the Family First Act,
right.
When you're out for that sick leave or you're out for the family care and all that kind of stuff, yes, you have to guarantee the person back in 12 weeks. Now, if they don't come back in the 12 weeks after that leave act piece is done for them, just like the normal FMLA for larger companies. If you don't return on that date, then you could be terminated.
Yeah, and one other weird little, well, not weird, but a difference between that is I believe that they reduced the amount of time that the employer was with the company to 30 days. So these could be relatively new people that you would have to preserve their job upon return after self-quarantine or illness or whatever. Okay.
Yes.
All right.
Yeah.
So Jim, anything else that, before we get into some of our questions that you really want to make sure veterinarians understand about this legislation and pending legislation?
Yeah, I have one more thing. We talked about the furlough, but the last alternative is to strictly lay your people off. What that means is you untie the knot with them. They're terminated. They have to go get COBRA. You're not paying their benefits anymore because long term, you don't know if you could call these 2 or 3 people back for maybe even a year. So why let them string along and why pay their benefits, conserve that cost, lay them off? That is probably the last alternative, but some have to do it, or they have to do 1 or 2 of those in their organization.
Yeah. And again, Vertical Vet members, this is why we partnered with Flex HR. You probably shouldn't make these decisions on your own. You should consult people like Jim. I mean, Jim, I thank you so much for being so gracious with your time. I know how busy you are right now. But, that's why we partner with people like this, because Jim can instantly look at your situation, your particular questions, and just clear cut. I mean, and if you haven't noticed already, he's a no nonsense kind of guy. That's one of the things that I like so much. If you haven't seen some of our other content that we've produced for Vertical Vet members, definitely check that out if you haven't. But, Jim has been around long enough. He understands the ins and outs, the intricacies, the nuances of these types of situations. But most importantly, he knows, and I would argue loves veterinary professionals. So that's one of the reasons that we like working with you. Well, Jim, anything else before we kind of get into some of these questions?
Yeah, let's go through the questions.
Okay, all right. Let me pull up something here, Jim. Let's see. All right. Sort of, what do you think about, how does this thing going to roll out?
It's all going to be done through payroll for all of the family first stuff, the sick leave and the tax credit, right? So what you're going to do, what you need to do, work with your payroll company, making sure they set up 2 new leave codes. One for the leave that you pay the max of $200 a day, and the other one where you pay the max of $511 a day. So those 2 different buckets so you can keep account of them. And what you're doing is you're paying people through that leave code that then shows up as a line item in your payroll. So then you'll be able to take that line item and take whatever federal tax that you owe on that payroll period and reduce your federal tax by that amount. Now, your payroll companies are working very, very hard at getting all of these things set up, so it technically will work decently automated. Yeah, you're going to have to do some manual stuff, but they're working very hard. Now, they're waiting for that final April 1st to see exactly what the rules are, but they're already setting up the codes. I know I have my codes all set up already, and we're waiting for the last piece on exactly how they're going to allow us to do it. Are they going to We could take it only out of federal tax? Can we take it out of Medicare? Can we take it out of whatever? So we don't know all those rules yet.
Right. And I would say this is where if you're using a cut rate service or a local person, this is going to be really complicated. Right. And so, Jim, I know your company is all over this, so I really appreciate that. All right, let's. Enacting it with their employee, they're taking this PTO earlier. Is it retroactive?
So the answer is no.
Okay.
We really tried to get that passed where it's retro to at least to March 15th. But again, we're going back to the intent of the Department of Labor wanting you to use your leave system until April 1st. So it's whatever you have allowed, PTO, sick time, vacation time, all of that, they need to exercise those to get paid. You won't get reimbursed by the government on anything that happens before April 1st.
Wow. All right, let's take a look at Jim, the way I'm reading that question is sort of just a brief summary of what we've discussed about how this is practically going to be, applied.
Right. And I think the number one thing is go start talking to your bank tomorrow. Go find out if they, or do they even have the form available for you to even start filling out so that you're ready on, moments notice to get it in first. We expect it to be full 2 months of expenses of running your operations and your employee expense. So we'll see what the fine print says, but I think anybody who could keep their people on board, at least 90% of their people on board and keep paying them, this is an unbelievable gift that the government is giving to small business owners.
Retain them, so you had 10 people and you ended up with 10 people or 9 people, or is it based on the hours? That's a great question.
It is based on full wages, so you must continue their full wages to get the money from the government and have your loan forgiven. So we do not know what they're going to forgive companies for until this act is passed, because some companies have already gone through layoffs,
right,
or told their people to go, or reduced their salaries or hours. And if this act is signed and says this goes into effect, let's say April 1st as well, then can we call the people back to work on April 1st and get this paid for? That is a huge question. We're waiting for that ink to dry on that law so we know how to guide everybody.
Wow. And listen, we need to be paying attention to you, Jim, because we're going to need guidance. That is a really important point you just made. That's a big uncertainty. And that is, okay, what if you've already reduced hours? Should you then try to game the system, so to speak, on April 1st? Everybody goes back up to full time or whatever. That's what I'm hearing, right?
That's what I'm hearing too. So we just have to wait for the darn law to pass and then see the print.
Yeah, please, Vertical Vet members, stay close to Jim. If you have not reached out to FlexHR, please do it. And I would like your input too. Any guidance for this veterinarian?
I think we're going to go back to, I wouldn't lay people off until this law is passed, hopefully tomorrow, and you can get your loan and you can keep the people working and you don't have to lay anybody off. If those two people reduced in a layoff will not result in 90% of your workforce getting laid off, then it may not be a bad idea because you're not going to come to full strength for a while.
Right.
So if they're asking to be laid off, you could do it in that 10% provision. Maybe it might be not a bad idea for you.
Wow, Jim, if there's ever been a devil in the detail, this one is huge. I predict that on March 31st, you will not sleep a wink.
No.
All right,
Yeah.
let's take a look at another. Address this with these sort of furlough type situations.
Yeah, I mean, you need to run your organization and keep it functional. And if you need to have X amount of staff not there, you're going to usually keep your experienced people that know how to do things, and you could count on them and all that. Usually, the junior people, you're still training and all of that, and you just don't have time for that right now. So, yes, absolutely, you could do that.
Yeah, and I'll tell you again, I guess I just cannot reemphasize the importance of keeping up with this legislation. It's moving so
Yeah.
quickly. It's such a fluid situation. But most importantly, if the rules are what are you doing as of April 1st, then you need to make sure that you are compliant with that. If they may, who knows, they may say the whole first of the year. Jim, it sounds like we just really don't know.
We don't know. Right.
Yeah, I think it really affects your practice to start with.
I mean, it's everything that we just stated above. It affects everything because number one, I'll guarantee you that one practice is going to be at 100% for a long time. Even if you only drop down 10%, it's 10%. You're losing 10% of your revenue, and you're going to have to do something with 10% of your expenses. So you're going to have to make some decisions. And will this come back immediately? No. Yes. Will vet practices come faster than, let's say, restaurants? I think so, because people believe in their pets. They want care for their pets, and they're going to continue that as soon as they can. You're starting to get backlogged of teeth cleaning and regular checkups and all that other stuff that they're going to want to reschedule and get in. So I think your businesses are going to move faster than most company businesses. I mean, restaurants, I hate to say it, it's going to be a long time before we're all settled to go into a very, very busy restaurant and sit there and feel comfortable having a meal served to us with people close to us and all of that stuff. It's a new day.
Yeah, for sure. So again, my biggest concern is that my veterinary colleagues, Jim, aren't going to be paying attention to this fast-moving process. They're going to get caught sort of behind, not being able to fully take advantage of some of these gifts, some of these legislative, rules that are really going to help relieve some of the financial stress they're going through. That's my biggest concern. Vertical Vet members, if you know a veterinary colleague who is struggling right now, I mean, Jim, of course, I'm sorry to put you on the spot, but I think you should probably send them to flexhr.com because, you guys are so good. And again, I don't want to somehow, be glib about this, but you really need help during this time, and this is the opportunity to sort of help others in our community, and that's what we're doing here at Vertical Vet. That's why I appreciate Jim taking time out of your busy day. I know how overwhelmed you are, but I couldn't think of a better person to turn to when I was having questions. I mean, I've been going through. I've got pages of notes here, and I'm still scratching my head around this thing, and I think that when I'm in these situations, me personally, part of my success, and Jim, I've probably apply this to you in a wide variety of areas. I go to people that are experts. I always want to take advice from somebody who knows more, who has experienced more than me in a particular area. And that's why Jim Cichanski and FlexHR are partners, valuable partners to Vertical Vet. I mean, so thanks again for taking time.
Hey, it was my pleasure. Thank you.
All right. Any other parting words of wisdom for vets out there that are, because look, I'm getting this scenario of like, is it over, man? Am I going to survive? Any kind of hope and optimism you can share?
One parting thought. It's lonely at the top. Owners, you don't have anywhere to go and vent and all of that stuff. And I have some owners just calling me saying, man, am I stupid for doing this or that? But one thing I think you need to think about is they're human beings working for you. You got to get work done through them. Treat them very fairly. I know you're stressed, management is stressed, but they are too. And open up the communications, ask how they're doing, make sure that somebody's not going off the deep end. Go use those EAP services that are available in your health plans and all that if they are getting into financial problems with their spouse getting laid off, maybe, and things of that nature. But be open to them because they're going to remember you for a long time on how they treated you during this crisis. And I think the best way to do it is treat them the way you would want to be treated.
Wow, Jim, you just said it all right there. Thank you so much, my friend. Stay safe.
Thank you.
Stay safe. We'll be in touch for sure. All right.
Thank you.
Well, Vertical Vet family, that is it for another special edition with our COVID-19 veterinary practice preparedness. One of the things Jim mentioned that I just want to kind of emphasize is it is lonely at the top sometimes. Owners don't know who to turn to. They don't have a community or group of trusted colleagues that have kind of been there, done that, feel that way. And that's why at Vertical Vet, we do have an invitation-only group called Platinum Groups. And so we've got them all throughout the country. If that's something that you're interested in, if you're a manager, we also have a special Platinum Group platform for managers. But if this is something that you want a little more intimate, groups of small groups of 10 or so, where we sit down, we have monthly meetings where we talk about the issues that are at hand. You can imagine we're lighting up right now when it comes to all of these issues. But if you're looking for that other level of sort of community, then definitely contact Vertical Vet and inquire about applying to be part of our Platinum Group. Again, on behalf of Vertical Vet, I'm Dr. Ernie Ward, Executive Director for Education. It's been my pleasure to bring with you an expert, Jim Cichanski with Flex HR. Really, this is the type of content that we want to bring you when you need it, and I don't think we need it any more than now. So, friends, stay safe out there and give your pets a hug for me. Until next time, talk to you soon. Bye.